I'm Megan Miller, and this presentation is about caring for the mental health needs of special populations. In this presentation, we'll explore mental health needs of elderly and geriatrics, perinatal and lactation, pediatric and adolescents, LGBTQ population, and immigrant and migrant workers. The term elderly or geriatric are used for patients over the age of 65. 56 million Americans are over the age of 65 and therefore categorized as elderly or geriatric. 1 in 4 elderly or geriatric Americans experience some form of mental illness. The economic cost of mental illness in elderly and geriatric patients in healthcare was greater than $200 billion in 2013. If we exclude dementia patients, that number was $163 billion that year. Elderly and geriatric patients should be assessed or screened for Alzheimer's disease, dementia, cognitive impairment, and depression. With each patient, you want to take a full comprehensive health history, of course, review their medications, any prior lab testing they may have had, any screening questionnaires that they're able to fill out can be helpful in understanding their mental health state. Some of those are the PHQ-9 and the GAD-7, and then any prior neuroimaging they may have had. The non-pharmacological and pharmacological treatment plan for the elderly and geriatric patients may vary when compared to other populations. Non-pharmacological treatments could include including a healthier, nutritious diet, having a good sleep hygiene, cognitive activities and social interaction can prove important for elderly or geriatric patients, and even emotional support animals may be helpful. It's important to remember that elderly and geriatric patients are at risk for polypharmacological complications, and therefore the lowest dose of medications or the least amount of medications is typically the best. Some medications that may help with mental health in elderly and geriatric patients are mood stabilizers, cholinesterase inhibitors, antipsychotics, and memetina. Perinatal and lactating patients pose unique challenges as well. Perinatal mood and anxiety disorders can have symptoms such as anxiety, depression, obsessive compulsive disorder, PTSD, and postpartum psychosis, and are experienced by approximately 15 to 21% of perinatal and postnatal women. Sadness, worry, fatigue, or what's called the baby blues, occur in about 40 to 80% of postnatal women. This often goes away on its own, but should be followed up with in the clinic. Definitely if the symptoms don't go away or they worsen. The U.S. economic burden of PMADs is high. Efforts to lower the prevalence of untreated PMADs could lead to substantial economic savings for employers, insurers, the government, and society. PMAD is estimated to cost $14 billion for births from 2017 when added up from birth to 5 years. While there is no real lab or diagnostic tests to diagnose depression. Screenings that can be done with these patients are similar to that of the geriatric patients, the PHQ-9 and the GAD-7. Of course, you want to obtain a comprehensive health history, any subjective data, and those screening questionnaires. The treatment plan for the perinatal or lactating patient is highly dependent on non-pharmacological interventions, such as obtaining adequate sleep, having proper nutrition, implementing self-care, having a regular exercise regimen, implementing cognitive behavior therapy or group therapy. Knowing that the patient has a good support system can also be helpful for their mental health as well. Pharmacological interventions may be contraindicated with pregnancy or with breastfeeding. Therefore, that needs to be taken into consideration when prescribing any antidepressants, antipsychotics, anti-anxiety medications. Risk versus benefit of these medications is also very important to consider. Things to consider when treating the mental health of pediatrics or adolescents is to know that anxiety and depression are very common in this age group. Depressive disorders happen in about 3% of younger children and 8% in adolescents. Those rates are actually higher in females than males. It's important to realize that less than half of these children receive appropriate treatment and referrals. The economic cost for pediatrics and adolescents with mental health concerns is $10.9 billion per year. Any mental health diagnoses, of course, must meet criteria from the DSM-5. Screening tools that can be used with children or adolescents is that strengths and difficulties questionnaire, development and well-being assessment, also the patient health questionnaire 2, the PHQ-2, and then the SCARED screening tool can be used to assess anxiety. Some indications for mental health screening for children greater than 5 years old are things such as any psychosocial concerns that their caregiver may have for them, any family disruption, which could be a divorce, a death in the family, a military deployment, things like that, poor school performance, behavioral difficulties, recurrent somatic complaints, and involvement of a social service or juvenile justice agency. These kids are placed in foster care or something like that. They may need a mental health assessment. The first line of treatment, of course, for pediatrics and adolescents should always start with non-pharmacological treatments. Some of those include making sure that they're getting quality sleep in the right amount of hours for their age group, to limit screen time, ensuring that they have adequate nutrition and cognitive behavioral therapy or group therapy, proper exercise as well can be helpful. Some pharmacological treatments could include supplements such as omega-3, DHA or EHA, vitamin D, folate, probiotics, multivitamins if they're lacking in nutrition. And then for any depressive disorders and anxiety, the first line of medications would be SSRIs such as sertraline, fluoxetine, or escitalopram. The LGBTQ minority group pose unique mental health concerns. 2 to 14% of the U.S. identify as LGBTQ, and approximately 39% of those report having a mental illness. Higher rates of anxiety, depression, and substance abuse are seen in this minority group when compared to their heterosexual peers. This has many explanations, such as lack of resources, lack of acceptance from their family, things of that nature. Economic costs for this minority group can be as much as $3 billion per year due to their mental health concerns. Assessments and screenings for this group would not be unlike the other groups, the elderly or pediatric even. You'd still want to use that PHQ-9 or GAD-7. It is unknown whether specialized minority screenings would be helpful or necessary. Again, for the treatment plan, you always want to start with the non-pharmacological treatments. This may include psychotherapy, cognitive behavioral therapy, group therapy, and then all those things such as, ensuring a proper diet, positive self-acceptance affirmations, yoga or meditation. And then for the pharmacological treatments, this may include gender-affirming hormone treatment, which would be special to this group as opposed to the other groups discussed. And then there's always antidepressant, anxiolytics, anti-anxiety medications. 4.7% of all workers are migrant or immigrant workers. 280 million people lived outside of their country of origin in 2022. Reasons for mental health concerns or not seeking treatment for this minority group could be stressful living situations. They're not living in their country of origin, they're away from their family, things of that nature. Any cost of treatment that they may not be able to cover if they're not working. They don't have insurance possibly, or they don't have the funds to support receiving treatment. Some cultural beliefs can get in the way of seeking a diagnosis or treatment. And then, of course, a fear of being deported. They don't want to go into a clinic and have to give their name and their identifying factors. The important thing to remember about this group when thinking about assessments and screenings is that anything on paper would be in the appropriate language for the patient to be able to properly read, and that there is an interpreter available, the best type of interpreter not being a family member or someone they brought with them if possible. The GAD-7 and PHQ-9 do come in many languages, so that should be available to them. And then for screenings, you want to question the patient possibly about traumatic events, anything that could have happened to them to cause their mental health concerns in order for proper treatment, any poor nutrition or lack of funds to get proper nutrition, and then any parasitic infections. For immigrants or migrant workers, the treatment plan would begin again with the non-pharmacological treatments, being sure to address causes of mental health concerns for this minority group is important. Any stress that they could be under, again, living outside their country of origin without their family, possibly financial stress, lack of insurance, the language barrier that might exist, any inadequate housing, as well as any lingering medical illnesses that may be untreated, any infections or infestations. And also receiving psychotherapy can be important for non-pharmacological types of treatment. It is crucial, though, to remember that this group will need language-appropriate therapist. Pharmacological treatments, of course, could include antidepressants, anti-anxiety, mood stabilizers, but again, information would need to be given to these patients in their language.